So hello and welcome to another Can Do MS webinar. My name is Jessica Kaplan and I am a programs manager here at Can Do. Our topic tonight for our webinar is Thriving with MS, Strategies for Aging Well. We're excited to partner with the Texas MS Consortium to offer two special webinars this month geared towards the Texas community. If you are here and you don't live in Texas though, don't worry. Most of the information is still going to be very relevant to people that are outside the state as well. I also want to just take a moment to thank our generous sponsors for supporting this special webinar series. Thank you to the Kathleen C. Moore Foundation and Novartis for their support in making this possible. And here we have our two speakers for this evening. Our speakers are coming to us from Austin, Texas. We have Leora Freeman, who is a neurologist, and we have Lisa Doggett, who is a family and lifestyle medicine physician and has also been living with MS since 2009. I'm going to hand it off to Leora to get us started.
Well, it's a pleasure to be with all of you tonight. I'm very excited to speak on this topic as we are going to try to help you thrive and live better with MS through the lifespan. And so we're going to try to first understand the challenges that come with aging, and especially when you age with MS. Second, we're going to learn some lifestyle recommendations and strategy to support aging well. And we're going to have some conversation around MS management and MS therapy and how that changes as we age. Next slide. So first, I wanted to show you kind of some data, some epidemiologic data, some data from the population that shows that the population of people with MS are now living longer. This data that I'm showing here are different curves that represent, the age of the population at different points in time. And we can see that now most of the population with MS is older than it was back in 1992. And so now most people with MS are in the age group of 55 to 64, which is, older than what it was back then when people were more frequently around 40 to 44. That's not the age that people are diagnosed at, but this is just kind of the most common age of people living with MS in the US right now. And so we see that as people live longer with MS, it's really important to help people with MS thrive across a lifespan. So what we want, our goal, and Lisa and I in today's webinar is really to kind of give you some strategy, not just to live longer, but to live better longer, to add more life to your years, and to really be able to have a healthful and happy life with MS. Next slide. The first thing to understand about MS as people age is that it tends to change. People are usually diagnosed in the earlier years with MS when they have a relapsing remitting course of the disease. So they experience relapses. What we know is that as people get older, so does their immune system. And this is a process that is called immune senescence. It's the aging of the immune system. And what happens in people with MS when their immune system gets older is that their immune system is much less aggressive. There's less inflammation, less acute inflammation that gets into the brain, causing new lesions and causing relapses. So what we see on the data graph that I show here is that the rates of relapses in both male and female tend to decline after, the age of 40, and particularly after 60 and 60 plus. While people with MS experience less relapses as they age, another thing that is important to understand is that if people experience a relapse when they get older, they tend to have a harder time recovering from their relapse, and they can have more deficits that persist after their relapse. Next slide. And this is because the whole biology of MS tends to change with age. When people are younger, particularly those that are diagnosed early in a relapsing remitting form of the disease, their disease is marked by the activation of immune cells in the blood in the periphery that get into the brain and cause these lesions and cause relapses. When this inflammation gets into the brain, it causes a demyelination. The myelin sheath around the nerves tends to break down. And then after the inflammation goes down, it repairs itself. That's a process called remyelination. And that helps protect the nerves against further damage. As people get older, what we tend to see is much less of this immune infiltration, but instead we see a chronic inflammation that lives within the nervous system. Not inflammation that comes from the periphery, but a low-grade inflammation that remains in the central nervous system. And that's also associated with more difficulty to repair, for the myelin to repair itself, and also for the nerve cells to stay healthy. All of this tends to increase the risk of progression of disability in people who are older. And this can take many forms. Most of the time, when people think about progression, they think about a motor progression. But as we'll see in the next slide, something to pay attention to as people get older is the possibility of cognitive symptoms as well. If you can go to the next slide. So cognitive impairment is a potential risk for people as they age, whether or not they have MS. When you get older, so does the risk of cognitive impairment tends to increase, but that can be more marked in people who have multiple sclerosis. We can see on the bottom, that at disease onset in the earlier years, most people with MS do not report any kind of impairment. When they are tested, they do not have any kind of cognitive impairment. As they, spend more time with MS, then more people start to have some issues with cognitive impairment. And by year 10, about half of people with MS will have either a mild impairment or a moderate impairment on their cognitive testing. Next slide. So what does cognitive impairment means? Well, it can mean many different things for different people. And even with MS, not everybody has the same problem. What we see most frequently is some issues with memory. People who have difficulty recalling information, like remembering names or words, that doesn't come as easily. Also, attention and concentration can be an issue. People have a hard time multitasking. Staying on task while having a lot of distractions become more difficult. They can have difficulty processing information, which can lead to issues with complex tasks or problem solving. And sometimes this can lead to also some difficulty with their visuospatial abilities. Something that I wanted to say about cognitive symptoms is that sometimes people come to me in clinic and tell me that they have some cognitive issues, and I will send them, to our neuropsychologist to have some testing and really look into it. And sometimes it turns out that their cognitive function is intact. But what happens is that they have other problems that, can make them perceive that they have issues with their cognition. And most of the time, those other problems are anxiety and depression. So it's truly important to pay attention to our mental health when we try to evaluate our cognitive health. And so if you're struggling with memory and symptoms, the first question to ask is really, where are you in your mental health as well? Next slide. There are things with aging that happen not just because of MS. So our bodies overall are aging, and this leads to other conditions that can occur with age: diabetes, high blood pressure, cholesterol, heart disease. All of those are what we call in our jargon comorbidities. Comorbidities are just conditions outside of MS that can also influence the course of MS. There's been a lot of research over the last 15, 20 years that have been done to understand what is the role of comorbidities, and what role do they play in the course of MS. And what was found, and that's the data that I'm showing here, is that people who have vascular comorbidities in particular, all of those comorbidities that I talked about, they can be at increased risk for progression. So it's really important because you can see on the graph here, what is shown is that people who have any vascular comorbidity will have a need for a walking aid about 6 years earlier than their peers. Those comorbidities can also play a very significant role in cognitive impairment and making worse all the memory issues and all the other problems that people may experience because of MS and also because of aging. Next slide. Something that I hear a lot about from my female patients is concerns about hormones. So what happens with age? For men experience a phenomenon called andropause, which is a very slow, decline in their sex hormones. Women, on the other hand, they will experience starting around age 35 to 50, kind of some fluctuation in their sex hormones, a phenomenon that's called perimenopause. And then after, their last period, then they have a significant drop in their sex hormones that can cause a whole slew of symptoms as this whole process of peri to menopause occurs. And people know, of course, of like all the hot flashes and discomfort that you can experience. And what's is kind of less known is all of these other symptoms that people can experience with menopause that can overlap and even mimic those of MS. So people, of course, can experience some sleep disturbances because of hot flashes or other. They can have mood changes. We see often people who have low moods, feeling blue, feeling depressed in the context of menopause. Bladder issues, which is something that's common in MS, or sexual dysfunction, can be aggravated by the menopausal process. And people often come back and, let us know that they're having more issues with urgencies and sometimes incontinence, sometimes issues with their sexual libido and other aspect of their sexual function. And all of that is kind of an overlap between MS and menopause. Cognition also can be affected by menopause, and people can describe it often as a cognitive fog. They just really have more problems than they usually have. Something that's important that I wrote here as well is bone health. Something that happens with menopausal women is the risk of osteoporosis, or loss of bone density. And this can be very impactful for people with MS because they can be at higher risk for falls. And then if their bone health is not really good, they can experience more risk of fractures. That's always something that I pay attention to. And then the always, present, invisible symptoms of MS, that is fatigue, is usually something that my patients report to me very frequently in the context of menopause. So there's just been a lot of studies recently, a lot of interest in that menopausal process, showing that, this worsening of MS symptoms that occur during this time. Next slide. So why are people experiencing kind of these changes during menopausal period? Well, there are some hormonal changes during the menopausal period, but there are also some immune changes that occur during that time. So the immune system is changed, and the low-grade inflammation that occurs with aging and because of MS is worsened by menopause. And this can lead to a change in the course of MS and a worsening of the MS process because of menopause. So all of these changes can lead to people having more difficulty walking, more difficulty with their cognition, having more difficulties in the day-to-day. So again, it's kind of part of it is the menopause plays a role because of, even the hot flashes and the increased temperatures kind of worsens MS symptoms. There's some symptoms of menopause that mimic MS symptoms, but also menopause tends to have an impact on the immune system that can worsen the course of MS itself. Next slide. Another issue that I pay attention to with my patients when they come and they want to age well with MS is how many medications they are taking. And so this is a term in our jargon that we call polypharmacy. Polypharmacy is when people take multiple medications at the same time. So there are different definitions of it. Usually they say 5 or more. As a neurologist, polypharmacy is something I see every day. People with MS need a lot of medications. What I pay attention to is not just the number of medications, but the number of medication that get into their central nervous system. And those can be medication that they take for depression, for pain, for attention, for many different things. There's different classes of medication that just get into the brain and play a role in the central nervous system. And what we've seen is actually a student of mine that did a study and that looked at the period of time between 2008 and 2021. And what we showed was that the number of people with MS that have polypharmacy of the type that gets into the central nervous system has increased over time, and particularly in women. And this is to us concerning because that can lead to complication. People who take a lot of medication that get into the central nervous system can be exposed to more falls, more fatigue, sedation, cognitive fog, and overall kind of worse quality of life. So when it's, possible, and we're going to talk a bit about strategies, it's really important to keep in mind, just understanding what the medications are there to do and how many you are taking. Next slide. Another thing that changes with age that is impactful for people with MS is the rate of infection. So if you remember earlier, I told you a little bit about, the changes that happens with aging and the phenomenon that we call immune senescence or aging of the immune system. And while it can have some benefit for MS where people don't have as many relapses, it also causes some general challenges where the immune system is not ready to fight back infection as readily as in younger people. So I'm showing you here some data that were pulled out from a study where they looked at the infection rate in people with MS in light blue compared to people who don't have MS in the darker blue. And what we see is that at every age, but particularly as people get older, people with MS have more infections or infection-related hospitalization, which are severe infections, than people who don't have MS. And so that's usually, as I said, the aging of the immune system and often compounded with the fact that, people with MS may have more, more issues with their immune system because of the medication they're taking, or they can have more problems with their bladder or others that can make them more prone to having infections. So the most common cause of hospitalizations would be UTIs, again, because of the bladder issues that come from MS. Pneumonia is also common. Intestinal infections, skin, and then overall sepsis is what we see as leading infections that lead to hospitalization. So that's something that I really, every time I see one of my patients in clinic, I will ask them, have you been having any infections? What kind of infections have you been in the hospital? And it's really, really important to pay attention to that. Next slide. So now that I've kind of laid the groundwork a little bit, we talked about the aging of the immune system. We talked about how it changes the MS disease course. We talked about the challenges that people have, infections, hormones, cognition, medications, all of those issues that can come up, more frequently as people age. Let's talk a little bit about what we can try to do about it. So I'm first going to talk with you guys about, working with your healthcare team. This is what I do as a doctor. I always say that my job as an MS specialist is not just to prescribe medications. Yes, it's important, but my role is to build your village. And I really want you to take this to heart. And we're going to go to the next slide. And a village for people with MS is a village that has you at the center. And I really want you to feel empowered to understand that it's not my village, it's your village, and I'm building it for you. And that means that it needs to be tailored to each of your needs. You may have a need for a mental health specialist if you struggle with depression or anxiety. You may have a need for a neuropsychologist if you struggle with cognition and memory and attention. You may have a need for a good primary care doctor if you have a lot of comorbidities and preventive health needs. And Lisa, I know, is going to get into that quite a bit. If you have bladder issues, I urge you to visit with a urologist because this can be a cause for urinary tract infections and hospitalization and decline. Then you can have a whole rehabilitation needs if you have issues with your mobility, with your fine motor skills, with your speech and memory. You may need a physical therapist, an occupational therapist, or a speech and language pathologist. This is your whole village. And so if your doctor is not building a village for you, then it's really important to advocate for yourself and understand what kind of medical specialist can see people with MS and understand who you could be referred to. I think that's really for me, and I always tell my patients, I need to put you in front of the people who know best how to manage what you have. I'm not a urologist. You need one, So really advocate for yourself to build this comprehensive care team that can support you for very different aspects. That doesn't mean that you're going to be spending your day seeing doctors, because that's not what we want. But that means that you can have a plan. And that also means that you can have somebody to go to if you have a really important issue. So that's really, really important. Next slide. So communication is really important with your care team. And I want you to hear about how to communicate effectively with your care team from Lisa, because she lives the life with MS and she can give you all the tips here.
Thank you, Leora, and it is really a pleasure to be here with you all. Yes, I've been living with MS for the last 15 years. I also have worked as a family physician for over 20 years. So I've been on both sides of the doctor-patient relationship. I think it's really important to make the most of your doctor's visits so that you can be efficient, so you can get your questions answered, and being an advocate for yourself is absolutely essential. I just wrote down some tips that I think are helpful, both from the physician perspective and from the patient perspective. One is certainly to complete your registration materials ahead of time. Increasingly, this is done through online, through their portal. But if you can't do it ahead of time, come early so that you can get your materials done on site. That really helps the physician. Again, helps you get the most of your visit. You definitely want to communicate openly and honestly. Sometimes I know that we patients want to tell our doctors, we know kind of what they want to hear, and we might want to be tempted to kind of just tell them what they want to hear. But in reality, we really owe it to ourselves to be as honest as possible so that they can make the best decisions along with us. When you have an appointment, you want to bring an updated list of all of your medications and any supplements you're taking, including like vitamins or anything else over the counter. You also want to bring your medical records and imaging discs if you have an MRI and you're needing to show your neurologist. Most of the time, an MS specialist will want to look at those images themselves if they don't have access to that system. Bring a list of questions and share that with your physician right off the bat so they can kind of help triage and help set expectations as to what you're going to cover that day and help guide the conversation. And then if you can, bring a trusted friend or family member. It can be so helpful to have someone there who can have a second set of ears and can take notes and can ask questions and help you advocate. We've mentioned advocacy several times. I know as a patient, I have had to do this over and over again. It is so frustrating when your medication is not delivered on time or your lab results aren't called into or don't show up in your portal as they're supposed to. You've got to be a good advocate for yourself. If you really feel like you struggle in that area, get someone else to do it on your behalf, but you've got to have someone kind of watching out for you. Ask for clarification if you don't understand your instructions. Know the next steps when you're finished with your visit. Make sure you're clear as to what you're supposed to do right after that. And have a plan to get those test results, because sometimes they don't show up as you're expecting them to, and you want to make sure that you know how you're going to get them and what the time frame is. Finally, if your doctor is not meeting your needs, you can talk to them about your concerns. Tell them what the issue is And if you really can't resolve the issue, they are just too rushed, or they're too distracted, or they just can't communicate, you just don't fit from a personality standpoint, it is okay to look for a new doctor. The National MS Society has a great website actually for finding an MS specialist, and you want to have an MS specialist when you have MS, and they can help you locate someone in your area. Just a quick note, this picture is my daughter. This was a few years ago, but this is just an example of good communication between the doctor and her patient. In this case, it's Snoopy. So I hope you enjoy that. Next slide.
So I know that, and I see already some questions about this in the Q&A, about making treatment decisions. And this is, as I said earlier, MS is associated with less frequency of less frequent relapses. And on the other side, our medications can feel less safe as we age because of the risk of infection that increases with age. So it's a constant balance that we have to juggle as doctor and patients hand in hand, trying to really do what's best for the MS while keeping people as healthy as possible and not aggravating a potential risk for infections in particular. I would say that treatment decisions can change as people age. There's a lot of now kind of questions about discontinuing treatment, or what we call de-escalating treatment, going from high efficacy treatments to lower efficacy treatments because they're less immunosuppressive. And so there's a lot of conversation about this. I will tell you from my personal experience that I think this is a very, very, very individualized decision. That balance doesn't look the same for everybody. And what is really hard is that I don't think that there exists, an age that for all patients, we should be discontinuing therapy, or probably after 70, 75, yes, probably we can stop everyone. But I would say that there is definitely, a challenge in deciding when exactly to discontinue treatment for each individual patient. And that's because age is just a number. And we know that there is a different concept, which is called biological age. So you may be 57 or 58, but your biological age may be 65, or your biological age may be 45. And that can influence the risk of relapses, the risk of the disease as well, and make those decisions a little bit difficult. So when I approach these questions, I think the first thing that I want to know is really what's in the balance. On the safety risk, yes, age plays a role, but it's not just age. Every 65-year-old with MS is not the same. So it's how many comorbidities you may have. What is your rate of infections on treatment? What problems may you have that can increase your risk of continuing treatment? Do you have a lot of bladder issues that have not been addressed? Do you have issues with your mobility that impact your ability to breathe well, that could make you more at risk of lung infections, for example? So I really want to understand for each individual patient what lays in the balance in terms of safety concerns with continuing treatment. And then I want to understand their individual disease on the other end, because some people, don't have relapses at all after age 60, but I've known some people who are diagnosed with a massive relapse at 68. So this is really, understanding with your doctor kind of what is in the balance in terms of your own disease profile, and as well as your own risk profile. So in general, I would say that it's important to have those conversations, really understanding the risk. I prefer to discontinue treatment before it becomes too risky, not in the context of a major complication, but I also want to really make sure that I'm not exposing people at risk of progression from their disease. One caveat that I would say to that is really important to pay attention to, that there are some treatments that can cause a rebound of disease after they're discontinued. And those are treatments that specifically stop the immune cell from moving around, like treatments like fingolimod or siponimod, treatments like tizabri called natalizumab. Those treatments, if discontinued without a plan, can lead to complications potentially. And so often I try to really not just stop these treatments abruptly, but I try to have a plan to phase out to another treatment first. So again, this is a very personalized discussion that's really based on own individual risk with the disease, with your own individual risk with regard to safety. Next slide. So another strategy, and we talked a little bit about this, is the risk of, related to the risk of polypharmacy. How many pain medications are you taking as a whole, but more importantly, how many medications are you taking that get into the brain and can increase risk of sedation, cognitive fog, and falls? So as Lisa said, always review your medications with your doctor. And remember, your MS doctor may not be prescribing all of your medications. So you need to bring your medication list with you so that your doctor understand which medications are prescribed by other doctors and understand what kind of interaction there may be. Also, it is really important for everyone to understand why you're taking any medication. So sometimes people come and like, well, I take this, but I don't really know why. And so it's really important to ask questions, ensure you understand why you're taking a medication, especially if it's a new one, and also understanding how it is supposed to work so that you know if it's working or not, and to not be adding medication just for the sake of adding medications. Next slide. With regard to hormonal health, so we talked a little bit about it, and this is something that I really encourage you to talk with your doctor about. Sometimes people come with me and meet with me and they tell me their MS symptoms have been worsening, but they don't really link this to hormonal changes. And so I tend to ask questions, how have your cycles been? Have you been experiencing hot flashes, increase in body temperatures, night sweats, all of this. And I ask questions about hormonal health, even though it's not necessarily in my field of expertise, just to understand, because sometimes treating those hormonal changes, either with some symptomatic treatments, with hormonal replacement therapies, can really help the experience of your symptoms, your MS symptoms that are worse because of menopause and because of hormonal changes. So always speak to your MS doctor, even if it doesn't seem to be related. Speak to your doctor about, your symptoms and whether they could be due to MS or menopause. Regarding treatment option, I mentioned this a little bit. Just know that hormone replacement therapies are not contraindicated for women with MS, and they can be helpful, as I said, with some of the symptoms of menopause. They've been shown that in some small studies that when taken by people with MS, it can sometimes help with depression or cognition as well. With menopause and with aging in general, there comes a lot of other issues, particularly osteoporosis. While this is not as much of an issue for our lovely gentlemen on the call, it can really be an issue for women starting around age 50. So please talk with your doctor about undergoing all kind of appropriate testing to know if you have osteoporosis, especially if you are experiencing falls or near falls. Next slide. And with that, I pass it down to Lisa to talk to us about preventive care.
Thanks again. We're going to spend just a couple minutes talking about vaccines, because I believe that vaccines are really one of the most important public health tools that we have available to us. As Leora was mentioning, infections are more common in people with MS. And so it is even more important for us to get the recommended vaccines. Vaccines are safe in people with MS. And we really need to stay up to date as best we can. Vaccine preventable infections can lead to long-term illness, hospitalization, and even death. Just a little perspective, over the last 50 years, vaccines have saved an estimated 154 million lives. This was a study published earlier this year. In the US, we know that there's about 1 million people who get shingles every year, and about 10 to 20% will develop postherpetic neuralgia, which is a terrible burning of the nerves and skin that can be long-lasting and lead to chronic disability. The last flu season was moderately severe, so fairly typical. And we had about 17,000 deaths. Getting vaccinated against shingles and flu, those are just two of the important vaccines that we recommend for everyone. with MS who is on a disease-modifying therapy or who is 50 and older. And flu vaccine is recommended actually for everyone, regardless of whether or not you have MS. Next slide. So specifically, I've mentioned a couple of these vaccines, but annual flu vaccine is crucial to prevent severe illness, hospitalization, and death. Usually the timing should be in the fall. September and October, maybe early November are usually the best times to get vaccinated against flu. COVID vaccines are regularly updated. There was a new one released in late August, early September. So if you have not had a COVID vaccine or been infected with COVID since then, you should get an updated COVID vaccine in most cases. This helps prevent an infection to a lesser extent, but particularly most importantly, COVID vaccines help prevent severe illness and hospitalization. Shingles vaccine or Shingrix is a very effective vaccine. There was an earlier form of it that was not as effective, but the Shingrix vaccine has been around now it's been about 5 to 6 years, maybe a little more, and it's recommended for everyone 50 and older, as well as those who are on certain disease-modifying therapies. Real quick, go back one second, I'll plow through these last ones. Pneumococcal vaccine recommended for those 50 and older. RSV vaccine, important to mention this one because it's new. It just was released for the first time last year for adults. It's for those 75 and older, or if you're 60 to 74 with risk factors. And then Tdap is the tetanus and pertussis vaccine. Okay, next slide. Thank you. And that's me getting my vaccines this year. I got COVID and flu at the beginning of September. As I mentioned, disease-modifying therapies are an important consideration, and you actually may need to have different timing of your vaccines depending on what immunosuppressant therapy you're on, if you're on one. As I mentioned, Shingrix and pneumococcal should be at a younger age if you're on disease-modifying therapy. And then I've listed the timing there for certain disease-modifying therapies, particularly those that are infused every 6 months. Sometimes an extra dose of vaccine is recommended, as is the case with COVID for this particular time right now. An additional COVID vaccine is recommended for those who have an immunocompromised condition. Finally, we want to avoid live vaccines. Fortunately, most are not live, but that is a particular risk for people that have MS or disease-modifying therapy. All right, next slide. This is a fantastic tool. We have a resource slide for you at the end, but this is one where you really might even want to take a screenshot because it is a great way where you can go in, put your age, put your other health conditions, and it will tell you which vaccines are recommended for you. I will tell you, most of my patients are not up to date with vaccines. There are lots of changes in what's recommended and what's not, and frequency, and it's hard to stay up to date. So a lot of people are not up to date, and this is a very useful tool to help you. Next slide. Okay, now we're going to talk about lifestyle medicine and how to optimize your health, shifting gears just a little bit. And probably most of you are not familiar with the concept of lifestyle medicine or lifestyle medicine physician. This is a newer field, but my field is focused on preventing and treating and potentially even reversing chronic conditions that are impacted by lifestyle. MS is not impacted as much by lifestyle as a lot of other conditions. However, all of us are at very high risk for developing heart disease, diabetes, cancer. Those are conditions that are very much impacted by lifestyle. And so one of the reasons that I work with Dr. Freeman, with Leora at the MS clinic here in Austin, is that we want to have a comprehensive approach to our patients. We want to make sure that not only is their MS well controlled, but they don't end up with another chronic, a comorbidity, as Dr. Freeman was talking about, where they can end up having severe worsening disability and worsening of their quality of life. So there are 6 tenets of a healthy lifestyle, of lifestyle medicine. One, of course, is nutrition. We're going to talk about each of these in a separate slide, but nutrition, sufficient and restorative sleep, stress management, avoidance of unhealthy substances, physical activity, and the last one up there in the left-hand corner is connection, which is my favorite, connecting with others, and healthy, supportive relationships. Next slide. So, why is lifestyle important? Why should I make any changes? And I'm going to provide a little bit of evidence and data about that. Next slide. So the toll of chronic disease, US life expectancy actually peaked in 2014 and then began sliding even before the pandemic. It's just recently starting to turn a corner again, but we've really seen some major issues around not the kinds of gains that we would expect from lifestyle, from a longevity standpoint. Chronic disease is the main reason that the US actually lags behind most industrialized nations. Our rates of heart disease, cancer, other causes, other chronic conditions are very common in people in the 35 to 64 age range, and are leading to deaths at younger ages. We also have a real significant issue with obesity. Nearly 42% of Americans are obese. This is obviously something that can be helped with lifestyle. About half of Americans have either diabetes or prediabetes. And comorbid chronic disease is actually more common in those of us with MS. Next slide. Healthy lifestyle can significantly reduce our risk of chronic disease. They are linked to better cognitive function, can reduce the incidence of heart disease by more than 80% and the incidence of diabetes by more than 90%. Just 30 minutes or more of physical activity on most days, avoiding tobacco, healthy diet, maintaining healthy body weight have all been shown to work together to significantly reduce your risk of other chronic conditions. And adopting just one positive behavior can cut the risk of heart disease by half. Next slide. So just a moment on nutrition. This is something that is so confusing in MS. I'm sure you all have been told there's, all these different diets and you need to do all these different things with your diet to improve your health with MS. And I'm here to tell you that there is not an MS diet. We don't have evidence yet of a particular diet that has been shown to significantly improve outcomes in people with MS specifically. However, we do know that the traditional American diet isn't healthy. The American College of Lifestyle Medicine has looked at all of the evidence, and not specific to MS, but for all of us to reduce our risk of other chronic conditions, they recommend a whole food, plant predominant diet. This specifically means we should all be increasing our fruits, vegetables, whole grains, nuts, seeds, and legumes or beans. Specifically, you want to reduce or avoid red meat, which contains a lot of saturated fat as well as cholesterol, and reduce sugar-sweetened beverages like sodas and energy drinks. When you cook with oil, if you want to use oil, olive oil is the preferred type of oil to use. And then just a couple of reminders, and these are kind of important statements to keep in mind. Cholesterol is only found in animal products. If you have heart disease, and all of us, again, heart disease is the #1 cause of death in this country, we all should be concerned about cholesterol. It's only in animal products. Fiber, however, also really important for everyone, for those of us with MS for sure. It is only found in plants. Next slide. Physical activity. So another really important tenet of lifestyle medicine. This one actually is probably the most important specifically for preventing MS progression and disability. There are studies showing a close connection between being physically active and reduction of MS-related disability. Physical activity reduces the negative effects of sedentary behavior, and most of us, including me, are too sedentary. It lowers the risk of cancer, diabetes, heart disease, and many other conditions. It improves sleep, mood, and fitness. And the guidelines for older adults recommend at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous exercise every week. So that's about 30 minutes of moderate intensity, like a brisk walk or a bike ride, dancing, swimming. Those are all potentially moderate, potentially vigorous, depending on how fast you're going. But 30 minutes a day, 5 days a week. 2 or more sessions a week of resistance training exercises of all major muscle groups is also recommended. That includes like weightlifting, core body exercises, doing squats, that kind of thing. And then finally, balance training is specifically recommended for older adults, and I would say it's important for everyone with MS, given that we are at risk of mobility issues. Any activity though, if you are just like, this is way too much, I can't possibly do this, I would recommend start with something. If you do 5 minutes a day, if you can't, you're really, really severely limited, you work with a physical therapist, but find a way to be doing something most days of the week. And that's going to be better than nothing, even if you can't meet the guidelines. Okay, next slide. Just a quick note about falls. Falls are a leading cause of fatal and non-fatal injuries in older adults. So I don't need to tell you that this is an even more of an increased risk in those of us with MS. The incidence is greater than 50%. Being active, maintaining our fitness reduces the risk of falls. Next slide. This is a terrific website that talks about the strategies that you can use to prevent falls. You'll see number one on that list is finding a good balance and exercise program. That's really important to improve your overall ability to adjust if you do have if you step the wrong way or you're climbing stairs, for example. Talking with your healthcare provider to do a fall assessment can be helpful as well. Reviewing your medications. Dr. Freeman talked a lot about polypharmacy, and this is really important to reduce fall risk because there are a lot of medicines that increase the chances of dizziness and sedation and increase our fall risk in those ways. Getting your vision and your hearing checked regularly and using glasses or potentially hearing aids can actually reduce your fall risk. Finally, keeping your home safe, removing tripping hazards, loose rugs, increasing lighting, and talking to your family members to enlist support are very important. Next slide. And then this is just a good graphic of the exercise requirements, recommendations for people who are 65 and older. I don't need to go through them again. Next. Medical clearance. It is important that if you're launching a new exercise regimen that you talk to your healthcare provider about what's safe for you. In particular, if you have chronic or unstable health conditions like those I've listed here or unexplained symptoms, you really do need to get clearance. Talk with them and make sure that you start with something that's reasonable and is safe, and then you can build your way back up to being more active, especially if you've gone through a recent procedure or hospitalization. Next slide. Stress management, super important, very difficult, but stress is important, is a contributor to a lot of different medical conditions. It can increase our productivity, but when it's in excess, it can lead to anxiety, depression, obesity, and immune system problems. I've listed some stress management strategies there that work for me and my patients. I'd encourage you to go back and take a look at it, but I'm going to move on for sake of time. Restorative sleep, I will spend a moment on this because this is potentially the most common issue that I see among my patients with MS. Sleep disturbance is also increasingly common as we age. It raises the risk of falls, mood problems, fatigue, insulin resistance. A lot of people don't know that, but very important, as well as inattention. We want to aim for 7 to 9 hours a night. In older adults, 7 to 8 is reasonable, but you do want to get at least 7 hours. If you have other underlying conditions, you want to address those like sleep apnea, pain, anxiety, and others. If you really are kind of following all of the guidelines for good sleep hygiene and still not able to sleep well, you do want to talk with a specialist about that. A couple suggestions: you don't want to automatically turn to sleeping pills. A lot of people use that because it's a quick solution, but it's not really a solution because it reduces the restorative sleep. You do not get into the deep stages or the REM stages of sleep that you need. Avoid caffeine in the afternoon and evening. Caffeine can stay in your body for 4 to 10 hours. The half-life is 4 to 6 hours in most people. So it can stay in your body for quite a long time and impact your sleep if you have even a cup of tea in the late afternoon. Don't use alcohol to fall asleep. A lot of my patients come in have fallen into that habit. It's not a good habit. It can, again, reduce the quality of your sleep, even if you fall asleep faster. And then establish a remember your good sleep hygiene. So that means going to bed and getting up at the same time 7 days a week. Use your bed for sleep and sex only, not on your phone, not watching TV, really trying to make sure that you associate being in your bed with sleeping. If you can't sleep after 20 minutes, you want to get out of bed and do a quiet activity, preferably in a different room. And then optimizing your sleep environment with a cool temperature, with as dark as possible. Those are important strategies, and no noise. That's all important to increase your chances of having a good sleep. Okay, next slide. Social connection. I have to go through this quick. I mentioned how much I love this tenet of lifestyle medicine, but in prioritizing relationships, so important to health. We're learning more and more about the impact of loneliness and social isolation on health. If you feel like you're disconnected, that is more common with age, but you want to try to prioritize important relationships, reconnect with old friends, look for ways to meet new people, volunteering, taking a class. Those are all really great strategies. And there are some good tools for that as well, like an organization called meetup.com. Next slide. Avoidance of risky substances. Really important to avoid alcohol, excessive alcohol, and especially tobacco. If smoking has been clearly shown to increase the risk of MS relapses. Marijuana is not a totally safe substance. I know a lot of people do use that, even to address some MS symptoms. You want to do that in conjunction with your doctor. Make sure you're doing it safely, because marijuana does have associated risks as I've listed. And I'll go ahead and just let you read the rest of that. I think the main highlight there is just to minimize your alcohol use. If you're over 65, you should be limiting alcohol to no more than 1 drink in a 24-hour period. Our livers just can't process more than that. Okay, next slide. Yes, it's never too late to adopt a healthy habit. So it doesn't matter if you're, how old you are, you can always make a change, and you will have some benefits from that in many cases. Next slide. This is the resource list that I promised. I have a lot of information here. I talked about the meetup.com for meeting people. There's some MS support groups, both in person and virtual, all over the country. Great exercise resources are here, as well as a wonderful nutrition information and support. There's some sleep tips from the American Academy of Sleep Medicine and the vaccine link that I showed you earlier. I think that's about it. All right, we have like 6 minutes for Q&A.
All right, thank you, Lisa, and thank you, Leora. You were both a wealth of information. That was a really great presentation. Before we jump into the Q&A, I just want to make a quick note that there's going to be a post-program survey that's going to pop up after the program ends. Please fill it out after the program so that we can continue to improve our future programming. I'm going to stop sharing so you can see us all a little bit bigger. And I saw, so Leora was answering quite a few of the questions in the chat.
And I can address just briefly a few of those questions kind of as a whole. I was asked a few questions, both in the chat and the comment. There was a question about that I didn't answer in the chat about how do I measure my biological age? So this is not a test that people can get routinely. There's different studies and ways that researchers are trying to approach this concept of biological age. So I know there's some studies that have been done out of California, looking at some kind of measurement of biological age using different type of blood tests. But this is not something that unfortunately people can routinely do. So hopefully in the next few years, we'll have a better understanding and a way of helping people measure their own biological age in clinical practice. Another question that I have is about measuring that low-grade inflammation in the central nervous system. And again, researchers are working actively on this. I come from a background of research using MRI and PET imaging, and there's definitely a lot of work. Still hasn't really made it into clinical practice either, but they're definitely used in clinical studies that look at medications that can target this kind of inflammation, which is what we want. We want researchers to have the tools to measure efficacy of drugs and hopefully downstream have access to those. I had some concern about remyelination. I have a great question. You've heard it's not smoothing MS, it's smoldering MS, the term that you've heard, which is kind of, yes, it is that same concept. Smoldering MS is a kind of a buzzword in the MS community right now. That really means kind of that low-grade inflammation. So what it means is that, unlike the inflammation that comes from the blood and gets into the brain when people have new lesions or relapses, this kind of smoldering inflammation involves other cells and involves involves what we call, for instance, microglia, a type of cells that lives in the brain that can become activated in the context of disease, not just MS, but also other disease. And we believe that those cells that live within the brain, those immune cells that live within the brain, when they become activated, they can be a part of the risk for progression. They can play a role in the worsening of MS. So yes, this is exactly what I'm talking about, this concept that some have dubbed smoldering MS. And as I said, researchers have ways of measuring this. I know that, in all my years as a neuroimaging researcher, we've used different MRIs or PET imaging techniques to do that. There's some blood work that are being developed to measure that as well. So that's really interesting. And then another thing that I talked about in the Q&A is, can you still remyelinate when you're old? And the answer is yes. Remyelination as the scale of the population tends to be less effective as people get older, but really there is a lot of variation from person to person. It seems like we have good remyelinators and poor remyelinators. So don't lose hope. Your brain still strives to repair itself. That's what I tell all my patients. Your brain wants to repair itself. And so what's important is using a lot of the lifestyle strategies that Lisa has explained that can help, create an environment that has less inflammation and that can also possibly, they're not demonstrated, promote repair. And then our hope is that we're going to have therapies that can promote remyelination in the future, but we're not there yet. What was that?
That was great. So looks like we've got time for just one more quick one. Someone would love it if you could review the cognitive changes that occur, and even going off of that, how do you distinguish between those cognitive changes due to age and the cognitive changes due to MS?
Yeah, so that's a really excellent question, and the answer is that it's really hard to know. First, because as I said, sometimes people have cognitive complaints but don't really have cognitive impairment. And also, when you are struggling cognitively to know whether it's MS or not, usually what we do in clinical practice is that, if people express some cognitive dysfunction, and that can be difficulty with memory, mainly kind of remembering words, kind of word finding difficulties, that's usually a very early sign. Also difficulty with attention and concentration. Also, people can have difficulty with multitasking. That's often kind of how people start out. They're like, I have difficulty doing my work. Cognitively, they can be competent, but they struggle with the noise, and so it's really important to be aware of that. Multitasking can be very difficult. And then difficulty with judgments, making, different decisions, and can come at a later stage. So the best way to help distinguish, is this aging, is this MS, is this depression, is this fatigue, is often to work with a cognitive health specialist. So we refer patients to neuropsychologists, which are specifically trained to do an intake visit with you, where they ask you all kind of questions about your mental health, your background, your education, your struggles. And then they do some standardized testing of the different domains of your cognition. They're going to look at your attention, at your memory, the way you recall information, the way those visual spatial strategies that you have. And they're going to be able to identify which domains are affected, which domain are strong, and they're going to see if it fits a pattern that's more related to MS versus just regular aging, because they're going to be able to compare to values of people your age. I hope that answered the question.
Of course, thank you so much, Leora. So it looks like that is all we have time for today. I'm gonna share my screen one last time. I just want to thank our speakers, Leora and Lisa. What an incredible presentation and so much information. I'm really glad that it's been recorded and we've got the slides to look back on. Everybody, you will be getting that follow-up email with the recording and with the slides in it, so no worries about that. I'll take one last second to thank our sponsors again, the Kathleen C. Moore Foundation and Novartis, which allow us to present topics like this and really bring on these specialists like Leora and Lisa. So thank you all for joining us tonight, and I hope you have a great rest of your evening.